The typical worker misses 3 workweeks, 15 days, annually for illness, injury or reasons other than vacation and holidays. However, workers with substance use disorders miss 2 more weeks annually than their peers, averaging nearly 5 weeks, 24.6 days, a year. Most of these extra days of missed work are associated with illness and injury. What is the real cost of substance use disorders? 1. The cost of job turnover and retraining. Studies show that the minimum cost to employers for recruiting and training replacement workers is 1/3 of a worker's annual salary. The additional costs to the employer rounds out at over 50% of the worker's annual salary. Costs are greater for workers with more education and training, and lower for workers who earn less and work in lower-skilled industries. Employer turnover costs are computed from the difference in the rate of 1-year turnover of workers in an industry sector with and without a substance use disorder. This difference is then compared with the average cost of replacement in that sector. 2. The cost of healthcare when the employee is sick. The United States spends about $35 billion a year to treat substance use disorders, and another $85 billion annually to treat the injuries, infections and illnesses associated with substance use. The cost of treatment for substance use disorders in the U.S. is not borne solely by families or their insurance companies. With higher utilization of treatment programs, health insurance premiums may rise. 3. The cost of lost productivity from sick employees. Nationally, almost 9% of working adults have a substance use disorder. This number includes 6.7% of working adults who have an alcohol use disorder and 1.6% with a cannabis use disorder. Higher rates of substance use disorders are found in industries with younger people, male-dominated workforces, such as construction. Other industries with easy access to alcohol, like entertainment and food service, also have higher rates. However, substance use disorders can be found in workers from all industries. 4. The emotional cost to the sick employee's family members and dependents. Employees with family members dealing with prescription pain medication addiction may face issues including financial problems, legal consequences, time spent caregiving or lost productivity at work because they are distracted by problems at home. Similarly, alcohol use disorder can affect family functioning and lead to physical and behavioral problems among caregivers. Studies have found that spouses of people with a substance use disorder are at increased risk of stressful life events, medical and psychiatric disorders. Employers may face higher healthcare costs if the family member is a dependent who receives coverage through the employer's health insurance plan. These data suggest it can be important for employers to consider the healthcare needs of family members as well as employees. Do you care to know how to reduce the cost of overall health in a workplace without reducing its quality or firing sick employees? Click the link below for details.